The purpose of this educational video is to address the topic of eating disorders, specifically anorexia nervosa and bulimia nervosa, and the critical impact they play on our cardiovascular health. Between the overuse of Photoshop in fashion magazines, the constant glorification of thinness in advertising, and the lack of racial and body type representation in Hollywood, there is no denying society's role in the development of eating disorders. Eating disorders are a group of serious conditions marked by an unhealthy relationship with food. They are related to persistent eating behaviors that negatively impact your health, emotions, and ability to function. Epidemiological studies have suggested that the incidence of eating disorders among adolescent girls has increased dramatically over the last 50 years. Today, more than ever, over 1 million Canadian adolescents are prone to concerns about their weight, shape, size, and body image, and as a result, diet to lose weight. No one knows the precise cause of eating disorders. However, extensive amounts of research has shown that they coexist with psychological and medical issues such as low self-esteem, depression, anxiety, trouble coping with emotions, and substance abuse. Eating disorders can harm the heart and digestive system and lead to a variety of other diseases if left untreated. Anorexia nervosa and bulimia nervosa, most common forms of eating disorders, have the highest mortality rates of all psychiatric disorders. To be specific, anorexia is the most lethal psychiatric disorder, carrying a 6-fold increased risk of death.
Anorexia nervosa is a disorder characterized by the fear of gaining weight and a distorted body image, causing a person to undereat. As a result, these patients lose an unhealthy amount of body weight as well as the loss of cardiac muscle in the heart, which can lead to a heart disorder called mitral valve prolapse. In a normal heart, the mitral valve is located between the left atrium and the left ventricle of the heart and allows blood to pump effortlessly in a unidirectional way. In mitral valve prolapse, when the heart contracts, the mitral valve fails to close and bulges into the left atrium, allowing blood to flow in the backwards direction. This can cause sharp pains beneath the sternum, palpitations, and fatigue. Mitral valve prolapse can be diagnosed by a doctor using a physical stethoscope by listening for a swishing sound indicative of a heart murmur.
Bulimia nervosa is a potentially life-threatening eating disorder characterized by cycles of binge eating followed by purging. During the binging phase, the individual has a compulsive need to consume large amounts of food without being able to control how much they eat in a single sitting. This is then followed by episodes of purging in which they attempt to rid themselves of the extra calories consumed in an unhealthy way. During purging episodes, people with bulimia often self-induce vomiting or misuse laxatives, weight loss supplements, or diuretics, which cause an electrolyte imbalance in the body. Electrical signals in the heart allow the heart muscle to contract. These signals are coordinated by the electrochemical gradient created by the flow of ions such as sodium, potassium, calcium, and magnesium. Of these, potassium plays a key role in allowing the heart muscle to relax to its resting state before another contraction can occur, which is known as repolarization. In bulimia patients, an electrolyte imbalance can lead to very low levels of potassium in the blood, which is known as hypokalemia. Lower levels of potassium can delay the repolarization period, which is reflected on an electrocardiogram as a long QT interval. The delay in repolarization, represented by a long QT interval, can lead to an EAD or early after depolarization, meaning that the heart may contract again before it is given a chance to fully relax. Collectively, EAD, potentiated by a prolonged QT interval, can lead to a ventricular tachycardia known as torsade de pointe. Torsade de pointe is one of the most severe types of arrhythmias associated with bulimia patients, in which contraction of the ventricles is generated by competing focal points in the ventricles that reflect on an electrocardiogram in a ribbon-like pattern. In normal individuals, the ventricular rate can range from 60 to 100 beats per minute. In contrast, individuals with torsade de pointe can have a ventricular rate of up to 150 to 250 beats per minute, which can degenerate into a ventricular fibrillation and cause sudden death.
These are just a few examples of the profound effects eating disorders can have on the heart. Recognizing the signs and symptoms of an eating disorder is the first step towards getting help for it. Eating disorders are treatable, and with the right treatment and support, most people with an eating disorder can learn healthy eating habits and get their lives back on track. Treatment for eating disorders generally involves a combination of psychological therapy and weight gain under the supervision of a healthcare professional. Cognitive behavioral therapy is the most popular and effective form of treatment as it enables individuals to recognize and change distorted thoughts that lead to eating disorder behaviors. Having an organized approach to eating disorder treatment can help an individual manage their symptoms, return to a healthy weight, and maintain their physical and mental health. Thank you for listening.